I'm Palin Sunhonchai. Today, February the 15th, 2018. Recently, there is a short clip growing viral on the internet right now.
So love me like you do, la la, love me like you do, love me like you do, la la, love me like.
Today, we have a special guest, Dr. Nachakar Leung Patharamethi, allergist from Chulalongkorn Hospital, with us today. Okay, so the first question that we would like to ask from the video, when he gave her the rose, she immediately sneezed. Is it because of the pollen?
Yeah. Pollen is one of the most common causes of allergies. Pollen is a very fine powder produced by trees, flowers, grasses, and weeds to fertilize other plants of the same species. Many people have an adverse immune response when they breathe in pollen. The immune system normally defends the body against harmful invaders, such as viruses and bacteria, to ward off illnesses. In people with pollen allergies, the immune system mistakenly identifies the harmless pollen as a dangerous intruder. It begins to produce chemicals to fight against the pollen. This is known as allergic reaction, and the specific type of pollen that causes it is known as an allergen.
What are different types of pollen allergies?
There are hundreds of plant species that release pollen into the air and trigger allergic reactions. Here are some of the more common culprits. First, birch pollen allergy, which is one of the most common airborne allergens during the spring. As the trees bloom, they release tiny grains of pollen that are scattered by the wind. Second, oak pollen allergy. Like birch trees, oak trees send pollen into the air during the spring. While oak pollen is considered to be mildly allergenic compared to the pollen of other trees, it stays in the air for longer periods of time. This can cause severe allergic reactions in some people with pollen allergies. Third, grass pollen allergy. Grass is the primary trigger of pollen allergies during the summer months. Lastly, ragweed pollen allergy. Ragweed plants are the main culprits of allergies among weed pollens. They are the most active between the late spring and fall months. Depending on the location, however, ragweed may begin spreading its pollen as early as the last week of July and continue into the middle of October.
What are the symptoms?
Pollen allergy symptoms most often include nasal congestion, sinus pressure, which may cause facial pain, runny nose, itchy, watery eyes, scratchy throat, cough, and decreased sense of taste or smell.
How is a pollen allergy is diagnosed?
We will first ask you about your medical history and your symptoms, including when they started and how long they persist. Make sure to tell them if the symptoms are always present or get better or worse at certain times of the year. We will then perform a skin prick test to determine the specific allergen that's causing your symptoms. During the procedure, we will prick different areas of the skin and insert amount of various types of allergens. If you're allergic to any of the substance, you will develop redness, swelling, and itchiness at the site within 15 to 20 minutes.
How is a pollen allergy treated?
As with other allergies, the best treatment is to avoid the allergen. However, pollen is very difficult to avoid. You may be able to minimize your exposure to pollen by staying indoors on dry, windy days, having others take care of any gardening or yard work during peak seasons, wearing a dust mask when pollen counts are high, and closing doors and windows when pollen counts are high. You can take medications too. If you still experience symptoms despite taking these preventive measures, there are several OTC medications that may help. First, antihistamines such as Zyrtec or diphenhydramine. Second, decongestants, such as Sudafed or Alfred nasal spray. Lastly, medications that combine an antihistamine and decongestant such as Actifate and Claritin D. Moreover, there are other treatments like allergy shots, which may be recommended if medications aren't enough to ease symptoms. Allergy shots are a form of immunotherapy that involves a series of injections of the allergen. The amount of allergen in the shot gradually increases over time. The shots modify your immune system's response to the allergen, helping to reduce the severity of your allergic reactions. You may experience complete relief within 1 to 3 years after starting allergy shots.
I heard that there are treatments like home remedies too, which includes firstly by using a squeeze bottle or neti pot to flush pollen from the nose. Secondly, by trying herbs and extracts such as PA-free butterbur or spirulina. Thirdly, by removing and washing any clothing that has been worn outside. Furthermore, by drying clothes in a dryer rather than outside or a clothing line. Or even by using air conditioning in cars and homes. Or investing in a portable high-efficiency particulate air filter or dehumidifier. And lastly, by vacuuming regularly with a vacuum cleaner that has a HEPA filter. Thank you, Dr. Nataka Leungpatharameti, giving us more information about allergy. Thank you for coming
And
as
this
well.
is special scoop from the Valentine season from EVA News.
Thank you and good night.